I've got quite an unusual clinical background. So I started work as a clinical geneticist. So for those of you who don't know what that is, that's a doctor who deals with people who either have or are at risk of having a rare or inherited condition. And I was very much involved in the setting up of the genomics service within Liverpool and Cheshire Merseyside and the wider Northwest. Genomics is really a huge innovation that has really taken hold since 2012. And I was very involved with setting up the 100,000 Genomes Project, and then involved with setting up the patient pathways around genomics. From that, I moved into a number of managerial roles, and then really over the last 18 months into my current role, looking at research, innovation, and precision medicine. So I have worked with the teams across the hospitals in Liverpool, and we've generated a research strategy and an innovation strategy and a new operating function. I've been inspired by many people across what has been quite an unusual career journey that I've had. And a lot of those individuals have been women. I have very much looked for female role models. And I think it's really good to take a look at lots of different people and think, what would I take from that person? What would I take from that person? Learn from the good, learn from the bad. As a doctor, actually, I've learned a lot from non-medics as well as from medics. And I have always been involved in multidisciplinary teams with scientists, with genetic counsellors, and in later years with executive teams, learning lots from different disciplines within corporate services. I've also looked at patients because patients bring a unique perspective. When you've sat with a patient over a 15, 20-year career and you've not been able to find a diagnosis for that patient, and you try, each time science moves forward, you've brought them back in, explained the new test that you've gone through all the emotions of, do they want to be tested, do they not want to be tested? And then 20 years down the line, suddenly you find that diagnosis, and seeing how people react, seeing people's response to that, I think has been really informative. As a woman in quite a senior role within the hospital, I was very blessed. As you can see, I worked at Liverpool Women's Hospital, where many of the senior people, up until when we became part of the group, were female. So I worked in a very female-dominated senior leadership team. And even now, we've got very good female representation on our board. So there's been this kind of ability to work with other women and to see how they work. I do think women work differently, and I think we should champion that. I think we maybe are more in tune with reading the room, maybe more in tune with our emotions, and I don't think we should shy away from that. I think there's a time and a place for being exceptionally direct. I've got no problem with being direct, but there's also a time to just sit there and absorb what you see and actually think about who's feeling what. How are they reacting to that person? And there's many men who have got that ability, many men, but I think as women, that intuition and that interpretation of emotion probably is easier. And I would say to any aspirant females in innovation or wider within the NHS, use those skills that you've got as being a female. If you think you've got them, use them. They can be an advantage. I'd say go for it. There's nothing like going for it. I think, as you know, there's the old adage where women have to be so certain that they can do something before they will apply for a job or they will move into a certain situation. So I think my message would be, you've got this, take your courage in your hands, go for it, because everybody's got a lot to offer regardless of gender, but do not feel that you are going to be held back because you are a woman. Go for it, give your best. There's lots of work for everyone to do. You're not taking work off anyone. Just take your courage in your hands and just put your foot forward and go for it.